Hi, good morning Parkar. My name is Angela Bay. I'm your invigilator for the OET-speaking session on the 2nd of May 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Parkar Greg.
And what is your candidate number, please?
My candidate number is 2659327.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Okay. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What qualities should a good nurse have?
A good nurse should be caring to assist patients in their most scary and vulnerable times. The nurse should have good communication skills to communicate effectively with other people, including patients, families, and physicians. Also, he or she should have empathy, be attentive to detail, be a problem solver, and be self-motivated.
What is your definition of a good working environment?
A good working environment is a workplace that is peaceful, secure, and promotes productivity. Also, it motivates employees to come to work. I understand that different health facilities have different working environments. Thus, I can adjust accordingly.
How does a typical working day of a clinic nurse look like?
A clinic nurse assists doctors, delivers patient care, monitors vital signs, administers treatments, and performs tests on patients. Other duties include recording patient behavior, handling medical emergencies, preparing patient documentation, and scheduling patient appointments.
How do you manage a lot of workload?
I manage my workload by prioritizing tasks. I identify urgent and important tasks, and ensure to work on them in order to finish them on time. Tasks that are least urgent and important come last. Prioritizing helps me to attend to all cases, based on their urgency and importance. However, I maintain a note of all work to ensure that I won't miss any.
How do you stay current regarding developments and trends in your profession?
I am a member of the Registered Nurses Association. Through it, I receive updates and news about happenings in the profession. I also catch up with the latest development in the field through nurses' social network groups. I have also subscribed to newsletters of various journals and publishers, along with the Nursing Council and WHO.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning, Angela. I am Parker Gregg, your daughter's attending nurse. How are you?
Good morning, Parker. I am good. Thank you for asking. How about you?
I am doing great, thank you. How is Anna?
She is getting better.
Good to hear that. Angela, I am glad to inform you that Anna is ready for discharge, and I am here to discuss the same.
But nurse, I am a bit worried about my daughter's readiness to discharge.
Oh, is it? The reason for Anna's discharge confirmation is that her post-operative recovery is very much satisfactory. There were no complications during the procedure and recovery period so far. Well, Angela, may I know about your concern, please?
Sure, nurse. My concern is because she has a sore throat and sounds as though she is speaking through her nose.
I acknowledge your concern, Angela. I would like to let you know that there will be some after effects of adenoidectomy. These are quite normal and self-limiting. Some of the common after effects are sore throat and change in voice, which Anna is currently experiencing. Also, earache, stiff jaw, etc. are usual.
Oh, I see.
Now, Angela, in case Anna experiences pain, you can provide over-the-counter painkillers, like paracetamol, for pain relief.
Sure, I will give her some paracetamol if she develops pain.
That's perfect. Do you have any other questions for me?
Actually, nurse, so far my daughter has only had liquids in the hospital, and I would like to know when she can start eating proper food again.
Your concern is understandable. I will guide you through the dietary requirements after adenoidectomy. The time scale for solid food is 3 days. By that time, her wound will heal to a larger extent. Meantime, it is highly recommended to provide food types that are easy to swallow. Choose foods that have a smooth texture and are non-abrasive. Hence, she won't feel difficulties in having them, and less chance of injury.
All right. I will follow your advice. But nurse, can I send her back to school tomorrow? That is just because I don't want her to get behind at school.
Being a mother, your thoughts are sensible. However, I'm sorry to say that she needs 1 week for recovery at home. I can explain why it is necessary.
Okay. You may please.
Currently she is highly prone to getting infected. Therefore, it is very essential to avoid situations that can spread infection. Some of the ways to reduce the risk of infection are to avoid contact with people having coughs and colds. In addition, no swimming for the next 3 weeks. Swimming will increase the chance of getting infection. Apart from these situations, avoid other common ways to get infectious. I hope it is clear to you.
Yes, nurse, I understand that. I will take care of it.
Good to hear that. Angela, do you have any other concerns?
Nurse, do I need to bring her back to the hospital for a checkup?
I appreciate your consciousness. Actually, no follow-up appointment is necessary for Anna's condition. Perhaps, if she develops severe symptoms, seek medical help.
All right.
Some of the instances Anna requires medical help are if she develops a fever, or else if she suffers intense pain. Moreover, prolonged bleeding from the mouth requires immediate medical attention. Make sure to check for any sort of abnormalities, and feel free to contact us without further delay.
Sure, nurse, I'll watch it carefully.
I appreciate it. Well, Angela, do I need to clarify any other questions you have?
No, nurse, it's all right. I hope my daughter will be fine, and she won't develop any serious symptoms.
Yes, Angela, with proper care and medication, she will recover faster. Try to follow our medical advice and instructions, without any failure, for a safer and swift recovery.
Of course, nurse.
Thank you for your cooperation. Always, feel free to contact us for any help. I wish your daughter a speedy recovery.
Thank you. That is the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.